Well, people who live with chronic foot pain will tell you just how much their life revolves around it, right? Dictating how much they can or cannot do on a daily basis. It's one of the main reasons my next guest went into the practice of podiatry. We have Dr. Vincent Staschiak joining me to explain all the ways his practice, which is Mid-Ohio foot and ankle specialist, can take away the pain. We're going to talk about one specific treatment today, but doctor, thank you for being here.
Thank you for having me.
All right, the most common foot and ankle problems. What are some of those that you run into as a podiatrist, because you see people every day and probably have these similar complaints, right?
Yeah, most commonly for every podiatry practice is going to be heel pain, whether it's plantar fasciitis or Achilles tendonitis.
Gotcha. Okay, so what most commonly would you say causes that for folks?
Repetitive micro trauma, walking, running, jogging, standing on your feet all day with inadequate shoes, improper arch supports, not enough cushioning, causing micro trauma to the tissues, which will actually begin to break down the tissues. And it's a lack of blood flow over time from that tearing that's occurring that is causing the tissues to harden up, called calcification.
Okay. Or do we just not know in advance enough to be able to prevent a lot of these? Is it that we choose obviously bad footwear? Like, what goes into kind of causing that when it gets to the point where you're going to need to see somebody?
Yeah, so whenever, as time goes on, most people who are active are either not stretching properly before they do exercises or after they do exercises, or you're on your feet all day, 8, 10, 12 hours at work inside of hard boots on concrete. And that micro trauma, that constant micro trauma, just causes the tissues to begin to break down. And as the tissues begin to break down, you lose your arterial flow to them and they begin to harden up. And that calcification begins to put pressure on the nerves that are going across the bottom of the heel or around the back of the heel, which is why people have their first steps in the morning is painful, or throughout the day. Sometimes at night their foot is just aching because the nerves are coming back awake.
It's incredible, because you think about obviously how much we take it for granted if you don't have that kind of pain, but to be kind of living your life like that, I'm sure is why people then come to you and say, what can you do for me, right? What are some of the main treatments that you're able to utilize to help folks with this pain?
So for about 80% of the population that suffers from heel pain, conservative therapy, stretching, physical therapy, massage, trying soft supportive inserts for your shoes, this will resolve the majority of people's discomfort. But it's that 20% that I look at, that I treat, that have tried every conservative option out there.
Yeah.
And their only option is either you live with the pain or you do surgery called an EPF, endoscopic plantar fasciotomy, where they're actually releasing a portion of your foot's shock absorber. And I've been telling people for 27 years, stop doing that. I wouldn't go out to my car, take a shock absorber out of my car and drive around with 3. So why do that to your foot?
Yeah.
Because your arch will begin to collapse over a period of a couple of years. So that is why I came in and just delved in 1998 and have done orthotripsy, which is a one-time procedure for the resolution of plantar fasciitis, Achilles tendonitis, knee pain, tennis elbow. The FDA approved it in 1998, but the machine has been around for about 40-some years. It originated for kidney stones and gallstones, called lithotripsy. And then in 1998, the FDA approved it for all of the heel pain, the knee pain, the elbow
all of
pain.
the above, yeah.
And I was one of the fortunate first residents to be trained on it in 1998 in my residency, and I saw the benefit of it right away. Within one session, we're able to break up all of that calcification, restoring the flexibility, and at the same time restore the blood flow to that tissue, because that is what started everything, was that lack of that blood flow. So by restoring the vitality and the flexibility, most people, after one treatment, which is all you need, are immediately 50 to 70% pain-free. And it just keeps getting better over a few-week period as that body's natural healing responses kick in and start healing everything on its own.
So let's take a look at the video of just how it works, and it seems incredible. Walk us through kind of then, what is that procedure like? How long does it take? What are people going through during it?
So the procedure itself, you wouldn't be able to take one shock. So I have to do local anesthesia to the foot in order to put the foot to sleep. And most people say the same thing. Those shots hurt for about a minute, but they would do it over again in a second of how they feel afterwards.
Yeah.
But the procedure itself takes about 15 to 18 minutes, and those high-intensity ultrasonic waves are actually breaking up all the calcification. And as I'm doing diagnostic ultrasound on the foot, taking pictures throughout the entire procedure, you can just see that band of tissue going from black and thick to thin and gray, meaning we broke up all the calcifications, returned the restored the blood flow to it, and just got the body on the process of healing and getting everything
And it's
the way it
almost-
was before you ever had any pain.
Yeah, it's almost like you're kind of telling the body to heal itself, which is always beneficial, which is always better when it comes to healing and kind of
Definitely.
treatments, right? So what kind of feedback are you getting from patients?
So usually about 90 I have a high 90% first-time treatment success rate.
Okay.
So if there's still the lingerers that because of the chronicity of their foot pain, maybe they had it for 10 years, they've tried everything. Even the people that have already had surgery that are still in pain, probably 30% of the practice is people that come in saying, I already had EPF, or I already had Achilles tendon surgery, or knee, or ankle, ankle or elbow. And it still
Lingering.
can resolve it
Yeah.
because it can still break up all that calcification and return that blood flow.
Well, that's great. So we're looking at people out there. I'm sure they're saying, okay, sign me up. How do I get started? Tell us how to get in contact where your practice is.
MidOhioFootandAnkle.com, and we are located in Lewis Center, Ohio.
Okay, so easy enough. And you got to get on the path to be pain-free, because I'm sure there are people out there suffering as we speak.
You don't appreciate podiatry until you have
Foot pain.
foot pain.
There you go. There you go. Well, doctor, it's a pleasure to meet you.
Same here.